Patient choice in this day and age is important, and certainly some patients want choice, and they want to choose when they have an appointment, when they see a specialist about having an operation, and if they have an operation, they want to choose when that is. They also want to be able to choose when they can see their own GP or how they can see their own GP.
What we need to be doing with the public is helping them to feel much freer, whether it be with their GP or their specialist or their nurse, to ask questions about what can I expect, where do you recommend, who's best at doing hip replacements, and these kinds of things. It's about patient empowerment, it's about public empowerment.
You know, a patient who comes in to see me as a GP and needs, say, a hernia repair, and I can offer them that hernia repair in a wide range of different hospitals. But actually they need help navigating the system because they don't know how to choose between all the different hospitals. So actually it's choice where it's important and for those that want it.
It's very well understood now that, for example, parents have to have a greater choice of school, different types of school to choose between those. We can see the same in local government services, a much greater range of providers using those services. But much deeper than that, you know, the most go-ahead leaders of public services want to see the users of services as a real resource which they can harness to make those services better and to solve social problems. So, you know, there's a sense that the health service needs to catch up, but there's there's a lot of very good experience which it can follow.
Over the last sort of decade, there's been lots of targets set around making sure that access improves, and those targets have been primarily aimed at secondary care. And they certainly have improved the access across the secondary care sector in terms of 4-hour waits in casualty, in terms of 18-week waits to have your operation after being referred for treatment. Where there's been less emphasis is on making sure there's access equally to community and primary care services.
So we need to create alternatives to high-cost A&E and even GP services, such as consultations in pharmacies and even nurse practitioners, as well as telephone consultations in the future, so that where people need reassurance and need the feeling that somebody's listened to their problem, they can get that without spending the 170 plus, which it costs for somebody to be seen in an A&E service, and it can be done much more quickly.
Using online services in order to book, cancel, change appointments, even consult with their GP is the way forward.
There are aspects of our life which are entirely digital. You know, I've not been into a bank, you know, I can't remember the last time I went into a bank. I virtually never go supermarket shopping. I book all my holidays online. We don't interact with the healthcare system in the same way. When I try to with my local GP surgery, I tried to book an appointment recently. I still can't book an appointment online or email my doctor about my condition.
A patient-centred NHS would first of all be an NHS where it'd be easy for the patients to get a service. But secondly, and even more important, be a service in which the patient felt that their interests and their concerns had been listened to and been taken into account in treatment planning.